So good morning, everybody. I'm very excited to see everybody here, and I want to try and give some context to the day and go and put the agenda that we have today in a broader context of some of the things that the faculty and the students here at MIT are doing, and hopefully energize everybody enough to kick off the day. So people mention here that the health system in the United States is under very significant pressure to change, to transform itself. And I want to start by trying to articulate very briefly what this transformation is about. So if you think about the current health systems that we have today, they are designed to provide discrete and reactive care for sick patients in very specified locations like hospitals and clinics, with a very much focus on isolated care by MDs. And they are being paid based on the volume of activities that they are actually perform. When you think about what we would like them to transform to and what they are trying to transform to, it's something very, very different. It's about managing patient population health rapidly over time. And I'm using here health in capital letters because the new notion of health is going to be something much broader and more comprehensive than just sickness. It's going to be about what people eat, about their lifestyle, about whether they smoke, whether they have an appropriate housing. And the fact that you're now thinking about population will actually require us to think very deeply, not only about what we do for every single patient, but also about how do we actually think about the welfare of the entire population we care about. Patient engagement is going to be in many more diverse modes and locations. We talked about maybe actually engaging quite intensively with the patient at home, measuring a lot of telemetry of the patient at home. That's going to kind of facilitate very different engagements with patients. It's not going to be anymore only MD focused. MDs will require to do a very different job going forward. It's going to be much more team-based, patient-centric, and data-driven and personalized. So in fact, the future of even the clinical care could be something that is much more tailored for every specific patient. And there is a dramatic change in how we would like to pay for health services. Specifically in Massachusetts as a pioneering state, it's not going to be anymore based on the volume of activities, but actually based on how much risk you managed, what kind of health outcomes you obtain, and how efficient you are. And these are very, very, very different objectives. Okay? Now, what is needed? This is a very traumatic transformation. The question is, what is needed from those systems in order to actually transform? Market incentives are important, and there is a lot of debate of the last 50, 60 years about the market incentive schemes. They are very important as a driving force, but they are by far not sufficient. And I think that we have a lot of evidence from the last 50, 60 years that just merely tweaking the incentive schemes of the market is not sufficient to drive the change that we just articulated. In fact, if you look on some of the pilots of ACOs, recent pilots, there is a growing concern that just merely changing the incentives and just telling people, oh, you're now taking risk is not sufficient. Some of these organizations are seriously struggling with actually transforming because it's actually a very ambitious and a very challenging task. It really requires system transformation that spans processes, organizations, workforce redesign. How do you use cost-effectively analytics and technology? We all talk about how technology and analytics are going to be a key, but I can tell you that most of the systems around this country are actually struggling how you actually leverage that to something that is cost-effective. And maybe most importantly, how do you actually think much more deeply about the behavioral aspects? Because if you now want to affect people's lifestyle and you want them to interact with technology, both the humans that are actually the patients and the humans that actually provide the care will be subject to human behavior. And if we don't understand those considerations, the most sophisticated technology, the most sophisticated analytics are not going to be very effective. So this is a very exciting challenge, but but something that I think we need to address if we actually want to enable this transformation. And of course, we have to continue to leverage the dramatic and the amazing advances. And again, we are in a state and a place that maybe represent some of the most exciting advancements in clinical innovation. Question is, how do we use that to actually create more effective systems that provide better outcomes in a much more sustainable cost? I want to take a few minutes to talk about what is unique, or what I believe is unique, about the group of over 30 faculty that we have here at Sloan, and many more if I think about the collective community here at MIT. What I think is unique about what we can offer to inform this transformation. And it's not an obvious answer. And many people ask you, why do you think that you can do something about this when you don't even have a medical school? I would argue that at some level that's actually an advantage, because it allows you to be objective and really come to this from a very fresh point of view. I think that Provost Schmidt mentioned the issue of multidisciplinary system thinking. I think that that's something that is very characteristic of us. We have skills and expertise in a variety of domains like organizational design, analytics, technology, behavioral aspects. But I have to tell you, there are other good universities that have those skills. What I think that really makes us unique is that the passion and the interest that we have among our faculty to actually work together and work across disciplines. So it's not just the expertise in each one of these fields, but it's actually more importantly the culture and the passion of people to actually talk across and work together. That's what makes us unique, I believe. Another area where I think that we can bring very valuable approach to the table is how do you actually build more data-driven and rigorous experimentation methodologies that actually allows you to think about system cost-benefit of different new solutions. I can tell you that many systems, in fact, all the systems across this country, including some of the most known in their being pioneered, take even Kaiser Permanente, take MGH, take all of these systems, they struggle with the stream of ideas, a stream of technologies that hit them. And they struggle to figure out how do you take all of these ideas and actually make it to something that makes sense, that is sustainable economically. And I think that there is very little infrastructure currently to allow those systems to actually think rigorously and experiment rigorously and learn what actually works. And I think that here we can be facilitators with collaborating with industry partners to actually build that infrastructure. I mentioned collaboration, but collaboration with industry partners, but I want to mention another aspect of collaboration that I think we can play a very key role in. If you think about most of the efforts that are being done to transform these systems, they are being done in great deal of isolation. Clearly between payers and health delivery systems and between different types of partners in the industry, but even within healthcare delivery system, there is very little learning that is happening across systems. I think that we can actually play an instrumental role being a convening and a facilitator bridge that will allow different stakeholders from the industry to come together, collaborate, and work together on these very, very challenging problems and learn together what actually works. And finally, I think that we have a lot to contribute through our action learning, training, and education activities. We actually focus on not training individuals. We have actually a very long track record in actually engaging with organizations and training organizations to actually transform themselves and think differently. So what is today's agenda? We're going to have 3 panels that relate each to some of the major system redesign challenges that I think exist. The role of telemedicine, how we manage chronic illnesses, and intra-system physicians incentives, which is essentially thinking about the question of how these big systems take the market incentives pressures and transform them into new ways to evaluate the productivity and the activities of their physicians and clinicians and reward them accordingly in a way that is aligned. Okay? We're going to have two distinguished keynote speakers, Elizabeth Becker and Niall Brennan. We're going to have an innovation session. And I want to emphasize that today you're going to see many of our alums, many of our students, many of our faculty across the entire campus here, and many industry practitioners and practitioner leaders. And I think that that kind of symbolizes to me the power of this place, that we can actually bring to the same room at the same time such a diverse audience with so many backgrounds, actually to discuss things, share ideas, and hopefully come up with some new solutions. What I want to do in the last 4 minutes that I have is to just give you a very quick sense about some of the research that is being done here by our faculty and students that actually relates to the content of today's agenda. In the afternoon, we're going to have another learning session for those of you that registered. So telemedicine. Telemedicine is a technology, is a broad range of technologies that basically allows us to connect with patients remotely, measure the telemetry, provide them care and service. It expands the location and the time that we engage with patients, but it also raises major issues about cost effectiveness. I mentioned that. How do we actually evaluate the cost effectiveness of those new solutions? Because they actually require quite substantial investments. We have many faculty that work on that, but I actually want to also emphasize that we have many of our former students, and these are just two companies. One of them is an online pharmacy, and another one is ClickMedix, is a mobile platform to provide health services. These are former students of us, of Sloan, that actually took the ideas and the insights and the energy and the passion about healthcare that they absorbed here while they were here students and took it to the industry and took it to the world and leading very successful and innovative telemedicine companies. And this span of both faculty and students working on these issues represent to me the various paths that we can actually make an impact. Chronic illnesses. These are some of the major chronic illnesses. If you think about why do we need to deal with chronic illnesses, these are, some of it is because we don't manage health very well, and some of this is because we just got so much better in caring for some illnesses or conditions that used to kill people. Now it made them being chronic patients. But it's an epidemic. It's an epidemic, and it's a huge cost driver. And one thing that is common to all of these conditions is it's really about, at the end of the day, affecting patient lifestyle and adherence. These are key. And this is exactly the two features that require fundamentally new systems in place. Now, Dimitris later on will lead a panel about diabetes, so I'm not going to talk about that. But let me just talk about very quickly about another very tasking chronic condition, which is heart failure. So basically, it's a condition that your heart doesn't function very well. It either doesn't pump or doesn't feel appropriately. Just to give you a magnitude of the problem, over 100 million hospitalization every year. Rate of readmission, 22% average nationally, some places much more. So that means that every 5 patients that you discharge from the hospital, one of them at least is going to come back within 30 days. Projected cost, $70 billion by 2030, which means that each one of us will pay $244 per year just to fund the care for those patients. And penalties for CMS for 30 days readmission, right? And I can tell you, every system across this country is working on the problem of reducing readmission rates, particularly of healthcare heart failure patients. But I would argue that this is the wrong problem definition. Let me just share with you some data from work that we do with some partners about heart failure patients. And it actually looked on heart failure patients that arrived to the ED, how many of them actually saw a physician in the outpatient setting in the 2 weeks prior to their arrival to the ED and the hospitalization. More than 50% did not see anybody. Another 20% saw someone on the same day that they were hospitalized after they were waiting more than 2 weeks. So I would argue that the real problem is, how do you actually build a system that prevents these patients from getting admitted, not readmitted, being admitted? How do you identify them? How do you initiate their care? But maybe most importantly, how do you monitor and escalate their care? Because currently the monitoring and escalation system that exists in most places is just them showing to the ED and being hospitalized. To me, that's a great opportunity for us to try and fix. But I also want to mention our former student, our executive MBA student, Bill Mangi, that actually redesigned the heart failure clinic at Yale, again, as part of a project, a course project that he did here at Sloan. So again, the connection between students and faculty. This is by far not what we do, the only thing that we do here. This is just a very small sample of the other things that we do here, research that we do, and the faculty that do them. So what do we expect from the day today? First, we hope to inspire and intrigue you, hopefully. But we also, more importantly, we want to engage you, because we actually need your support. We need your ideas. We need your passion. We need your energy. We need your time and attention and support. So I wish all of us a day of inspiration and engagement. Thank you.